It's very nice to be connected to you all, even if I can't see you, which is a little unusual for me, but very glad to have this opportunity to talk with you about mindfulness and its usefulness as a clinical intervention and also a path to wellness. I'd like to start by just briefly telling you a little bit about myself and how I came to find a way to bring my personal interest in mindfulness together with my professional work as a physician, as a psychiatrist and researcher. I had a long-standing interest in meditation going back to college, and over the years found it very valuable to me personally, but had not brought it into my professional work. With my move to UMass Medical School, where the Center for Mindfulness in Medicine, Healthcare, and Society is located, I was very fortunate to be able to begin to do just that and to collaborate with some incredible teachers there and with other researchers here at UMass to focus both my research and my clinical work on mindfulness. This talk will focus on mindfulness as a clinical intervention and an approach to wellness. We'll begin by talking about what mindfulness is and how it can be used for helping people with certain conditions. We'll specifically focus on mood disorders and mindfulness-based interventions for mood disorders that involve problems with regulating emotion. And we'll end with a focus on some of the research, both in terms of clinical research on effectiveness and the neuroscience. Mindfulness begins with an awareness of the fact that most of the time we are not fully present for the moments of our lives. Instead, our thoughts and actions are usually driven by what we might call habits of mind and behavior. We operate on autopilot very often without full awareness of what we're doing and what's going on both internally and in the world around us. We tend in this busy society that we're in to engage in multitasking, where we're doing multiple things at once. And we spend a great deal of our time rehashing things from the past and anticipating or even worrying about things that haven't yet happened in the future, and amazingly little time being fully present in the current moment. And I think most people can probably relate to that. Beyond missing out on so many of the moments of our lives and the deeper texture of life, it turns out that we tend to be on autopilot in the ways that we react to stress and various challenges in our lives as well. This stress reactivity can contribute to poor resilience to stressful events, to vulnerability to develop problems with mood regulation, and for people that have mood disorders, this can be particularly problematic. And vulnerability to stress or difficulty managing stress can obviously also contribute to relapse and to worse outcomes for people with mood disorders. We tend to encounter stress or difficulty in a reactive way, that is, automatic ways based on these habits, as I mentioned, of mind. And they often are not very helpful for dealing with the situation and can even be harmful to our health. The repeated activation of the body's stress response leads to dysregulation of body and mind. We evolved a fight or flight response to allow us to respond to danger and threat in the environment. But in modern society, this stress response is most often activated by events that we encounter, situations that do not pose immediate physical danger to us, but in fact can contribute to our well-being in a negative way over time if we have difficulty managing stress or lead very stressful lives and encounter very difficult situations. This repeated activation of the fight or flight response, the stress response, contributes to chronic diseases like cardiovascular disease, stroke, and diabetes. And these diseases, in fact, are the leading cause of death in the United States and in industrialized nations, and increasingly in other parts of the world as well. And I would also mention that these diseases are also primarily responsible for the lower life expectancy in people with psychiatric conditions. So I think it's particularly important for people with mood and other disorders to become better able to manage stress and respond effectively to stressful events. Finally, as I mentioned, repeated exposure to stressful events can contribute to negative course of mood disorders and poor quality of life as well. Chronic stress has also been shown to cause us to age faster. This cartoon shows you telomeres, these blue caps at the end, if you can see the cursor here, at the end of chromosomes, protect the chromosomes from degradation, and in cells that repeatedly divide, these caps have to be replaced, and that depends on an enzyme called telomerase that restores them to the end of the chromosome. Over time, with age, telomeres tend to shorten, and this process can be speeded up by repeated exposure to stress, as has been shown in some fascinating and very important work by Alyssa Epel and her colleagues at University of California, San Francisco, in collaboration with Elizabeth Blackburn, who shared the Nobel Prize for the discovery of telomerase and its role in cellular aging. So in this study by Epel's group, they studied a group of women who led difficult, stressful lives due to having to care for severely disabled children. They measured their levels of stress as well as other variables they controlled in this study for age and weight and other factors. And what they were able to show is that the women that rated their stress most highly had shorter telomeres, the red bar on the upper graph, and also lower levels of the enzyme that replaces and generates the telomere cap at the end of the chromosome compared to women who described experiencing less stress in their lives. Women with the highest level of perceived stress, in fact, have telomeres that are shorter on average by the equivalent of at least 1 decade of additional aging compared to low stress women, which is quite striking. I won't go into this, but this group has been doing some very fascinating research on mindfulness as an intervention for helping people in leading high stress lives to respond better to these situations and improve in some of these metabolic indicators of the effects of stress on the body. In addition to its effect on the body, our habitual reactions to stress often cause us to perseverate, stimulating negative, repeated thoughts about why is this happening to me, about not being able to handle the situation, even catastrophic thoughts, as illustrated in this quote from Mark Twain, which I'm very fond of. "I have been through some terrible things in my life, some of which actually happened." Perseveration, the repeated cycles of negative thinking associated with prolonged activation, prolonged stress or repeated stress, also stimulates prolonged activation of the amygdala, the region of the brain, which we'll talk a little bit more later about, in the limbic system, that is also responsible, that is not only responsible for the body's fight or flight response to threat, but is also responsible for negative emotions such as anxiety, depression, anger. So our response to stress often results in generating these negative emotions, I'm sure to no one's surprise listening. Mindfulness can help us to become more mindful and less automatic, to be present for more of the moments of our lives, because after all, it is only ever these moments that we have. We only have this moment at any time in our lives. And with practice, mindfulness can help us to be less reactive to our experience and more resilient to stress as well. I like this definition of mindfulness proposed by Jon Kabat-Zinn: the awareness that emerges from paying attention on purpose to the unfolding of experience from moment to moment. Each of the components of this definition is important. Paying attention is an intentional activity where we focus our attention. That's the purposefulness of paying attention. We do this non-judgmentally, which is not easy to do, and we maintain this continuity of awareness through the unfolding of experience from one moment to the next. Training in mindfulness practice can help us strengthen the ability to focus our attention and sustain that focus without being carried away by our usual mental activities, our habits of mind and behavior. Training in mindfulness often begins by teaching breath meditation. And I would like to invite you to join me in a brief practice of mindfulness meditation with a focus on awareness of the breath. And if you care to join me in this, I invite you to, if possible for you, to sit upright in a chair, possibly on the floor, but it's also perfectly okay to be lying on the floor. You want to be supported, have the back straight, but not stiff. Become aware of the support provided by the floor and whatever you're sitting on, providing all the support that is needed in this moment. Become aware of the body sitting in stillness. And gather your attention and bring it to focus on the breath wherever that is most noticeable in your body. For some, that will be at the nostrils as the air moves in with each in-breath and out again with the out-breath. It may be the expansion of the chest and the falling back again. Or it may be the movement in and out of the abdomen. Wherever you choose to focus, seeing if you can get close to the experience of the breath in this region of your body. Staying close as the air moves through the body for the full duration of the in-breath and the full duration of the out-breath. Breath by breath, moment to moment. Inevitably, other things will pull at your attention. You may notice your mind wanders off into thoughts, or you're distracted by a sound. Perhaps even you experience some discomfort in the body. This is quite natural. And as soon as you become aware of it, simply acknowledge where the attention has gone and bring the attention back to focus on the breath. resuming the moment-to-moment awareness of breathing. With no intention here other than to be aware, without trying to control the breath in any way or achieve any particular state. Each time the mind wanders or is pulled away, gently bring it back. This is quite natural. Acknowledging that this can be available to you at any time. It can be a way of caring for yourself, of pausing in our busy lives to rest in awareness and to be fully present in this moment. I invite you now to gradually let go of awareness of the breath. If you've had your eyes closed, to allow them to open, to become aware of the space you're in. And if we were able to have a conversation now, I would be curious to know how many of you found this relaxing. And I like to point out that this is quite interesting that many people do, even though there was nothing in my instruction about relaxing. Relaxation is a response that accompanies this focusing of our attention and our awareness, especially when we focus on the body, but it can be done with other objects of attention, such as a mantra. And I wonder how many people also noticed that their breath slowed a bit as they paid attention. And finally, whether you noticed your thoughts perhaps settled a bit and slowed down. Alternatively, some of you might have experienced something like this. So the chatter that goes on in our minds most of our waking lives is quite normal. It becomes very obvious when we try to slow things down and sustain our attention on a particular focus. We come to notice how the mind is constantly trying to distract us from being present with a variety of thoughts and comments and judgments about liking this and not liking that, about how long will this go on, when will it be over, perhaps with memories and associations from the past or worries about the future. This is what the mind does. The breath can be a very useful focus of attention because it is always with us, and it is the thread that runs through every moment of our lives, from the moment we're born to the moment we die. It's always available as an anchor for being in the present moment. And it's a way of connecting mind and body. As we do so, our breath tends to slow down for many of us without any conscious effort to do so. And our minds tend to become quieter, and this can be quite useful. Back in 1979, here at UMass Medical School, John Kabat-Zinn developed mindfulness-based stress reduction as an intervention for people suffering from certain chronic conditions, including chronic pain, and to help people to reduce stress in their lives and reduce the impact of stress. This program was described in his book, Full Catastrophe Living, and is designed to be conducted in a classroom format with a teacher and participants that are very much part of the program. The discussion that goes on in the classroom is as much a part of the intervention as the formal practices that are taught. Shown in the lower picture, for example, is the body scan, which is the first practice that is taught to begin to train the attention, to be able to keep it focused on a particular object of attention and to be able to move it around as needed or as we desire. Participants also learn to incorporate mindfulness into their daily lives, and they learn about health and health behaviors and the impact of stress on their lives. The initial research by John and his collaborators here at UMass and later by others were quite promising, as they showed improvements in pain and quality of life for people with chronic conditions, and also improvements in clinical symptoms of anxiety and other conditions. This led to a growing awareness of MBSR, mindfulness-based stress reduction, and its benefits. And as you see in this graph on the left, the number of publications since John's initial publication in 1982 has grown exponentially as of last year. Paul Grossman did a meta-analysis and published the results several years ago on the studies published up to about 2003. A meta-analysis is a statistical technique that allows us to pool the results of many research studies to have a much larger sample size and to look at the overall effect size of an intervention, of a clinical treatment or intervention. The major findings there were, as I mentioned, improved quality of life and also a greater sense of well-being, improvements in physical health in terms of reduced pain and physical impairment, and also in mental health with improved symptoms of anxiety, depression, and coping with stress. Beginning in the 1990s, several researchers recognized the potential for mindfulness to be helpful for treating anxiety, depression, and other conditions, and began to study new interventions that incorporated mindfulness. Dialectical behavior therapy, developed by investigators interested in developing a better treatment for borderline personality disorder, and acceptance and commitment therapy, developed initially for anxiety disorders, are examples of interventions that use mindfulness as part of an overall treatment or intervention. And another type of intervention, as with mindfulness-based stress reduction, is our mindfulness-based cognitive therapy, which is based on mindfulness-based stress reduction, takes the basic format of the 8-week class, the classroom format, the role of class discussion, the teaching of practices, incorporates into this elements of cognitive therapy for initially for depression, and is now being studied for other applications. And similarly, mindfulness-based relapse prevention for helping people with substance abuse disorders avoid relapse was based on mindfulness-based stress reduction as well. I'm going to focus on mindfulness-based cognitive therapy, which was developed by investigators Zindel Siegel, Mark Williams, and John Teasdale, who had been researching the cognitive model of depression and the factors involved in relapse of depression, which, as many of you know, once someone has had an episode of major depression, they're much more likely to have another episode, and with each episode, more likely still. The same can be said of bipolar disorder. These investigators recognize that mindfulness could be very helpful in helping people to recognize the patterns of negative thinking that contributed to a relapse of major depression. And they actually came to UMass Medical School to visit, to study, to learn mindfulness-based stress reduction, and then went back to modify it for the treatment of depression or prevention of relapse of depression. They published their book about the intervention, Mindfulness-Based Cognitive Therapy, which is now in a second edition, and they also published a companion book for people utilizing this intervention, The Mindful Way Through Depression, published in 2007, which comes with a CD that includes the guidance and the practices. The additional component in mindfulness-based cognitive therapy, as I mentioned, it comes from cognitive models of depression and the negative thinking styles that characterize people who have had experience with depression, and how mood reactivity tends to trigger this kind of thinking, which can eventually lead to a recurrence as the vicious cycle of negative thoughts and sad moods goes on. This little diagram illustrates the cognitive model wherein we will notice that our mood has dipped and relate that to a particular experience and attribute it directly to that experience, that event in our lives, when in fact what cognitive research has shown is that it's much more the interpretation of the event that leads to changes in our mood and certain thinking patterns than the event itself. The same is true of stress, by the way, and stressful events are known to affect people differently, and it's not so much the event that leads to the experience of stress as how we perceive stress, if you will, interpret it, that creates the stress response and our perception of stress. And this is much more strongly related to the negative outcomes of stress than being exposed to stressful events itself. Mindfulness-based cognitive therapy teaches us to recognize these patterns of mind, and the mindfulness practices teach us to stay present in awareness of the actual experience, the event in this diagram, and to recognize thoughts as mental events and not necessarily reality. So interpretation, being thoughts, thought activity, cognitive activity, we can learn to recognize this as mental activity and not necessarily an accurate representation of events or our experience. When we get good at this, we're less likely to have the negative thoughts and interpretations in the first place, and when we do, we're less likely to experience the negative emotions and the vicious cycle that can lead to a relapse. A critical part of MBCT is learning to recognize how we tend to turn away from unpleasant states of mood, sad feelings, which is quite understandable, especially if we've been depressed or had mood episodes, but in fact can be unhelpful. Instead, mindfulness-based cognitive therapy teaches us to turn towards difficult experience without trying to change it. So focusing on low mood, sadness, for example, over time, as difficult as it may seem initially, gets easier, and the mood itself, the impact it has on us, can diminish considerably as a result and lose its power over us. This can be tremendously empowering to people who have been driven by trying to avoid and escape unpleasant feelings. And I can attest to, having worked with a number of patients now, to just how liberating this, they describe this experience when they learn to do this. It's quite different from learning to distract ourselves by focusing on the breath, for example, or other relaxation techniques. In this case, mindfulness is being applied to the unpleasant experience, the low mood, the sadness, the anxiety itself directly. So going back to our definition of mindfulness, this is the unfolding of our experience moment to moment, whether it's pleasant or unpleasant. So let's turn in the remaining moments of this talk to the research and see what it has to say about whether mindfulness works as an intervention. We'll be focusing on mindfulness-based cognitive therapy again, and how it may work in terms of its effect on the brain. There have now been several randomized controlled trials of Mbct for depression. It's also recently been the focus of studies for bipolar disorder as well, although it's still early. To my knowledge, there have now been 7 randomized controlled trials of Mbct for depression. And randomized controlled trials are the standard for clinical research, for the methodological approach to demonstrating the effectiveness of an intervention. These studies have been conducted in different countries and by different investigators, and the results are quite consistent. In general, for people who have had 3 or more episodes of depression, Mbct reduces the rate of relapse by about half, which is quite striking. So until this finding, and it's being replicated, psychiatrists like myself were taught that the only option for patients with depression who had had several episodes was to stay on antidepressants, to recommend that they stay on antidepressants for the rest of their lives to prevent another recurrence. Now, I don't want anyone to think that they should go off of medications on their own. This is certainly something that needs to be thought about quite carefully, depending on your individual circumstances, and done in consultation with your physician. But this is an exciting finding and a encouraging development in thinking about mood disorders and the tendency of them to come back. The standard of care, as I mentioned, is to remain on antidepressants. So in the largest study and the most important study to date of Mbct for depression, Siegel et al., one of the developers, did a study where they randomized 160 people who had had several episodes of depression to 3 conditions. They compared people who were continued with the standard of care, that is maintenance antidepressant medication, MADM here, the dotted line. Mbct, in which patients were gradually tapered off antidepressants if they did well, and placebo, medication placebo plus usual clinical intervention. You can see here in these curves, this is called a survival analysis, that over the 18-month follow-up period of the study, so this is now 16 months, the endpoint is 16 months after the Mbct class ended, that the patients who were randomized to placebo plus usual care did not do well and had a roughly 80% chance of recurrence during that period, which is consistent with the research on recurrence of depression in people who've had several episodes. People maintained on antidepressant medication did much better, not surprisingly, but also people randomized to Mbct did equally well as people maintained on antidepressant medication. There is also now evidence that Mbct can be effective for people who have residual symptoms of depression and are not between episodes. And this, in fact, is the case for a very large percentage of people with depressive conditions and other mood disorders. So this is also very encouraging. People can benefit even if they are experiencing symptoms of depression. The hope is that MBCT can be adapted for bipolar disorder to also reduce the chances of recurrence of mood episodes. It is still early, but so far the studies published do not indicate it works as well in bipolar disorder for preventing episodes of depression or mania. Although, as I say, it is early and there are some studies underway which we're eager to learn the results of. However, one study has found that MBCT reduced anxiety symptoms in people with bipolar disorder, and another study suggests it might help improve cognitive function as well. So there may be important benefits of MBCT for bipolar disorder, even if we're not able to demonstrate the same results as for preventing recurrence of depression. I'd like to turn now to what the neuroscience tells us about how mindfulness works. And before I do so, I'd just like to introduce the concept of neuroplasticity. Contrary to what we believed for a very long time in the field of neuroscience, that the brain was fixed once we became fully mature as adults, it turns out there's a great deal of plasticity that is change that is possible. The complexity of neurons, being the number of branches of nerve cell fibers, is quite dependent on our experience, and has been shown in many studies now to be responsive to our environment and to our experience. Even the number of cells in the brain can be influenced by experience. New cells can be generated, and the rate of new cell generation can be affected by experience in certain limited examples in the brain. And finally, connectivity, which I'll talk about later, that is how well connected, how strong the connections are between neurons, is also influenced by experience. So although I don't have time to go into it, fascinating research on learning new skills, for example, musicians learning to play an instrument, learning to perform various functions or activities, has been shown to result in changes in the brain that can be demonstrated on MRI. For this same reason, there was a lot of interest in looking at the brains of people who practiced mindfulness meditation, and I'm going to focus particularly on the studies that looked at participants who had undergone the 8-week mindfulness-based stress reduction program. So using the classroom format that we talked about before, Richie Davidson's group, in collaboration with John Kabat-Zinn, back in 2003, published the first result demonstrating that just 8 weeks of MBSR training resulted in lasting changes in the brain. This was actually an EEG study where they showed that the distribution of cortical activity in the frontal part of the brain shifted as a result of MBSR in a positive direction, and that this shift was still present 4 months after the MBSR training. This shift is associated with less negative emotion and avoidance. This group in the same study demonstrated lasting changes in the immune system. The participants in the study were given flu vaccines, and antibody titers were measured. In the participants of the MBSR class, the titers were much higher than in the control group that did not take MBSR, demonstrating that MBSR can affect other aspects of the body and physiology and immune function. We know is involved in many of the responses to stress that are unhealthy and can lead to chronic disease. A structural study by Sarah Lazar's group at the MGH, Mass General Hospital here in Massachusetts, found that 8 weeks of MBSR also produced structural changes in the amygdala, which, as we discussed, is involved in the stress response and negative emotion. In this study, they found that the 8-week MBSR class led to a smaller amygdala in the participants, and that this reduction in the volume of the amygdala was correlated with a reduction in the ratings of perceived stress by the participants from before to after taking the 8-week class. In another study by this same group, MBSR was found to produce increased volume in the hippocampus. This part of the brain is involved in learning and memory and also in emotion regulation, and has been shown by other research to be very sensitive to the effects of chronic stress and actually shrinks in response to chronic stress. So people with post-traumatic stress disorder, for example, have smaller hippocampi. In this case, MBSR produced increased volume in the hippocampus in the MBSR participants compared to controls. Finally, I want to mention briefly some research that my group is doing here at UMass, my collaborators, including Saki Santarelli from the Center for Mindfulness and neuroscience investigators here in the Department of Psychiatry. We are looking at connectivity between the amygdala, outlined in red here in this diagram, and the prefrontal cortex in a study funded by the NIH, where we are, in the interest of time, I'm going to speed up. We're looking at the relationship between response to stress and also negative emotions and health behaviors such as eating. So in this cartoon from the New Yorker, which I like quite a bit, the caption reads, "What do you eat for anxiety?" And this is two people standing in front of a bakery shop looking at baked goods. We can all relate to the fact that under stress, we may tend to eat foods that are not healthy, to engage in other behaviors that may not be the most healthy for us as a reaction to in the moment. We believe MBSR may be helpful in people who are attempting to maintain weight loss after losing significant amounts of weight, and we're recruiting subjects that will be enrolled in a study using MBSR and will undergo MRI scans to study the connectivity between the amygdala and prefrontal cortex as a result of undergoing MBSR, and how this may relate to and help predict response to MBSR for helping people with health behaviors and maintaining weight loss. So just to finish up, there is information available about mindfulness-based stress reduction on the website of the Center for Mindfulness here at UMass Medical School, and this is the web address. There are MBSR programs in 42 states around the country, some 521 programs, so it's widely available, and the website can direct you to programs all over the country. You can get more information about mindfulness-based cognitive therapy from the Oxford Mindfulness Group, and finally, I'd be happy to take any questions, certainly after the Q&A period today on this webinar, if you care to email me. Thank you very much for your attention.
Thank you. Our first question is, I am from the University of Geneva, Switzerland. I'm wondering how current technological solutions, and particularly personal smartphones, can help in practicing of mindfulness. Are there some wearable sensors available for that purpose, or any other personal technologies affordable for masses?
You know, there are. It's an interesting question, and I know there's a lot of interest in research on this very question. So I'm not very familiar with it myself. I know there are apps that have been developed. I've been told, I have students who work with me on my research, and they tend to be more aware of the technology and the apps, that there are apps that can be used to help people with relaxation. There are apps for mindfulness I know that I've heard about. There is something called the Insight Timer that people can connect with other people doing meditation around the world, actually, not in a dynamic way to interact, but to know that other people are meditating. So there's quite a lot of interest, and there's also a lot of research interest. So there are studies underway to look at how this technology may be helpful in allowing people to utilize, to benefit from mindfulness training and perhaps to engage in it.
Thank you. In these studies, how often do the participants participate mindfulness cognitive therapy, and how long was each session when they practiced it?
Thank you. I should have mentioned that. So the basic format of the mindfulness-based stress reduction program is the same as Mbct. 8 weeks of classes. The classes are 2 to 2.5 hours long, plus an all-day session that involves practicing throughout the day. The classes involve training in mindfulness practices like the body scan, which was shown in the slide, also sitting meditation, the breath meditation as we did, learning to expand our awareness during meditation to include sounds and thoughts and feelings. Yoga is a core component of the intervention, a mindful form of hatha yoga that helps us to become more aware of our bodies and to settle the mind and again expand our ability to focus attention, to be present at the moment. And so the instruction when taking the class is there's homework given each week, and the homework involves practicing one of the practices about 40 to 45 minutes a day in the days between classes, and also to engage in some of the informal practices applying mindfulness to the activities of our daily lives. So this is, in terms of the research that I showed you, this is the amount of practice that was involved in addition to what goes on in the classroom itself, and the all-day practices, the homework, what people do on their own at home, is about 40 to 45 minutes a day.
Thank you. I'm a psychotherapist in San Diego County. Can these techniques be applied with children ages 7 to 18?
There's a tremendous amount of interest in that, and I am aware that there are investigators doing studies, that there have been a few things published. There's not a lot of a research base yet. There is certainly a lot of talk about it at conferences. There are trainings that you can go to. A woman named Gina Beagle has developed a manual for doing mindfulness-based stress reduction with teens, and I'm aware that people are doing these trainings and practices with children even younger in the age range you mentioned. So there's quite a lot going on. The research on it has not quite caught up yet. But from what I understand, I know a couple of people personally who work with kids and teenagers. They find it as helpful for them as we do in working with adults, which is the focus of my work.
Thank you. Does mindfulness-based cognitive therapy reduce relapses in substance abuse?
So there has not been as much research on mindfulness-based relapse prevention. I'm sorry, was the question about mindfulness-based relapse prevention or MBCT?
MBCT.
Well, that's an interesting question. I'm not aware that anyone has looked at it. So as most of the listeners are probably aware, substance abuse is a common problem in people with mood disorders. And so it is worth, certainly something that I would be interested in, but I'm not aware that anyone has done the study yet as to whether MBCT for depression or another application other than substance abuse itself leads to reduced substance abuse in people who also have substance abuse or reduced relapse rate in those individuals.
Great, thank you. I'm going to take care of children 0 to 5 years old who have social emotional challenges. Would this be recommended for them, and would it be recommended for people with bipolar 1?
So to take the first part of the question, given that the research, the evidence base is not there yet for working in such a young age group, the 0 to 5, if I heard you correctly.
Yes.
I can't say that it can be recommended. But as I mentioned, there are people doing this kind of work. Anecdotally, I know of people working with kids in preschool in that age range, and they tell me some wonderful stories about how the kids take to it and how it can be helpful for them. But that's anecdotal at best. As for bipolar 1 disorder, as I mentioned, again, the research is not quite there yet. There is evidence that it can be helpful for aspects of the illness, the anxiety, and some of the cognitive function. As to randomized controlled trials to show convincingly that it is able to reduce relapse, certainly there's nothing, we don't have the research yet, and there's certainly nothing there to suggest that it should be used in place of or in conjunction with trying to reduce reliance on medication. So I want to be very careful about that not being a recommendation at this point until we have more evidence from the research.
Okay, thank you. And do we have any other questions? This next question is, do you have any recommendations for CDs or iTunes app sites that you can recommend to lead people through the MBCT practice?
Yes, the slide I showed, The Mindful Way Through Depression, the book that was published in 2007 is available, well, it's available as a book with a CD that has John Kabat-Zinn leading the practices, giving guidance in the practices. The book itself is very well written and will guide you through. It's not exactly a manual for doing MBCT, but certainly guides you through the main concepts and what is involved, and is available as an audiobook as well. And I understand that there is a companion manual for the full MBCT program that will be coming out, I heard, later this year, but is not yet available.
Wonderful, thank you. I think those are all our questions for now. We're just getting feedback that everyone's saying thank you so much. This was an excellent webinar. So we really appreciate your time and for being with us today.
You're very welcome. Thank you.
Thank you. Goodbye, everyone.